This is to introduce to you all our dental practice, which started, orthodontic practice, which first started in 1968. At that time, orthodontics was the only dental specialty which you could exclusively practice. Gradually, as time grew, patients were mainly referred by other dentists, and then of course patients came referred by their own relatives and friends. At that time, we never used to start practice orthodontic treatment at an early age. We would wait till all the deciduous teeth had fallen and permanent teeth had erupted, and then decided whether this patient needs extractions, non-extractions, and how we proceed further. At that time, most of the cases which had crowding or protrusion were straight away referred for extractions, and there was no in between, or one didn't have a chance to do intermittent orthodontic treatment because the permanent teeth were already erupted. Today, one starts much earlier in mixed dentition so that you can convert an extraction case into a non-extraction case and yet get a good result. Our teacher, Dr. Udani, used to tell us that when you are treating a patient, you should feel that you are sitting in the dental chair and are getting treatment, and that is the attitude one should have towards practice. From the beginning, we have tried to maintain an ethical practice so that as patients come and see you working, they also get the confidence of continuing treatment or starting treatment.
At our clinic, we like to educate our patients in the initial consultation. When the initial consultation happens, we explain to them what to expect from the treatment, how do we go about doing the treatment, and after treatment retention phase also is given an idea in the first appointment. After the first appointment, we call the patients for initial treatment records. After the treatment records are collected, we again call patient along with both the parents for treatment planning. By doing so, we are educating the patients. Patients know what to expect from the treatment, and then everything goes smoothly. The doctor, the patient, as well as the parents are on the same page. Nothing comes as a surprise to the patient or the parents 6 months down the treatment. If it is an extraction case, we like to tell the patients from the beginning that it's an extraction case, please go ahead. We are not start the treatment and then tell the patients to go in for extraction. By doing so, patient's confidence is won and everything goes smoothly. As doctor was rightly mentioning that in the past century, half a century which he's been into practice, orthodontics has come a long way. Doctor used to practice Begg's appliance. In those days, there were no interceptive orthodontic treatment being done. Now with interceptive orthodontics, we are converting extraction cases into non-extractions. Previously, more than 60 to 70% of our patients were extraction cases. Now that has reduced to almost 20%. Now with modern orthodontics, there are different type of appliances that are available. We do the appliances that we use are the conventional pre-adjusted edgewise MBT appliance, which is the labial braces. Then we do lingual orthodontics, ceramic brackets for labial orthodontics. We do Invisalign. Now with these modern appliances, we are able to cater to a much larger population. Adult orthodontics has become a reality in this country. In the old days, people would be conscious of wearing braces. Now that has changed because of lingual appliances and Invisalign coming in so very aggressively in our country. The final results that are achieved with the conventional metal braces are on par with the results that are achieved with the modern appliances, that is Invisalign and lingual orthodontics.
Relapse of any orthodontic treatment is a nightmare for an orthodontist. Hence, one has to be very careful from the beginning that retainers are used as instructed and the patient follows the proper way of wearing retainers and continues to do so till told to discard them. When you see that, you find that the mothers bring their own children for further treatment because they are happy with the result of their original work.
In retention, I would like to add that in the old days there was fixed bonded retainers one given. Now we provide patients with fixed bonded retainers as well as removable plates. If retainers worn properly under doctor's guidance with proper follow-up and checkups, we are reducing the chance of relapse to a very high extent. We've seen, thanks to Dr. Javeri's practice, we have had the privilege of treating second generation, third generation patients. The patients who have worn their retainers and done the treatment with due diligence, those patients have got a very good result, stable result, and they have practically eliminated any dental problems for them out.
I always had the fear that had something to happen to me during the practice, my patients would be left confused as to where to go. And I had seen that happen when an orthodontist suddenly expired or fell sick and could not continue the practice. The patients were also confused about their own treatment. Hence, having somebody in place who had met the patients and the parents earlier and who could continue the treatment was a much better option for everybody. It was a win-win situation for the doctor and the patient and the parents. After many years of practice, I thought it was high time that I passed on the practice to somebody much younger with more modern thoughts and modern appliances to be used, and that is how Dr. Rotiwala came into the picture. We were working together for many years, and after a while I thought it was time that I should retire and leave the practice completely in his hands, though we do sit together every now and then and discuss cases and proceed further.
I consider myself fortunate to have inherited a practice of Dr. Saurabh Javeri. Not only the practice, from practice I have learned to be an ethical practitioner, take care of the patients and deliver the best possible result to the patients.
With God's grace, I can happily say now that I have had the pleasure of treating 3 different generations of patients, and it has been a novel experience.
Hope, like Dr. Javeri, I also have the privilege of treating the next 3 generations. What started in 1968 by Dr. Javeri, I would like to take it forward by the same principles set by him for the clinic, maintain the same standards and deliver the best for our patients.